Self-Management Week. ALISS in action. Barbara Flynn, Development Officer, The Alliance. Follow us on X at Self-Management Scot and Alliance Scot.
So hi, I'm Barbara Flynn. I'm one of the development officers in the self-management team at the Alliance. So just a wee bit of background information, first of all, about who we are, for those of you who may be unfamiliar with our work. The Alliance Self-Management Programme grew through recognition of all the really rich learning that was coming out of the Self-Management Fund, which our team have administered on behalf of the Scottish Government since 2009. Awarding over £28 million in funds to 464 projects across Scotland that support self-management. We now have 4 people in the team, and as well as supporting funded projects, we are the central point of contact for the Self-Management Network Scotland, a network of over 900 people across Scotland with an interest in self-management. The network is free to join and brings together individuals, third sector workers, NHS staff, and more. And we act as a liaison between all members to facilitate knowledge sharing, introductions, training and support. And we also produce and distribute a monthly bulletin for our members. So really encourage us to join if you're not already a member of that network. We also organise Self-Management Week and awards each September. This was first launched in 2010, and the aim of the week is to highlight some of the very best practice being demonstrated across Scotland, to raise a profile of self-management and to share learning across networks and sectors. The week brings people together to learn about different self-management approaches and the benefits of self-management for people in Scotland, particularly for those people living with one or more long-term conditions and those who care for them, but as well as for healthcare professionals. And through this year's theme of journeys, we've been aiming to highlight the different paths that self-management can take people on towards achieving improved health and well-being, and that idea of how self-management enables individuals to move forward in life. Another part of our work is we deliver self-management reflective practice, which is a CPD accredited training module for practitioners who support people to self-manage, which I'll speak more about that in a wee minute. But first of all, what do we mean by self-management? This is something that we get asked often in our team. There are many different definitions as it mean different things to different people. But in a nutshell, at the Alliance, we define it as people living with long-term conditions being in the driving seat. And this definition is taken from Go On Yoursel, the self-management strategy for Scotland, which the Alliance was asked by the Scottish Government to develop alongside people who live with long-term conditions. So in the context of health and social care, self-management means supporting people to live their lives better on their terms by encouraging people living with long-term conditions to access information and to develop skills to find out what's right for their condition and, most importantly, what's right for them. And it's these words, support and encourage, that are really key to it. As when we talk about supporting people to self-manage in our roles as health and social care workers, as Professor Lisa Kidd stated, this is a wee quote from her, relationships are the bedrock of self-management. And this quote you can see on the screen, is taken from a webinar that Professor Kidd delivered as part of last year's Self-Management Week, which is still available on Alliance Live, actually. Really, really great webinar. And Lisa is a professor of nursing at Glasgow Caledonian University, which she's done loads of research into supported self-management. And you know what she says it really kind of captures the essence of what we try to deliver in our self-management reflective practice sessions. You know, so she says it's about moving away from the sense of doing things to people and acknowledging people's priorities, assets, skills, experiences and insights that people themselves bring through their lived experiences. And this is something that requires courageousness, confidence and collaboration from practitioners. So why self-management? What are the benefits? Well, as this image shows, on average, an individual will spend 4 hours per year in front of a health professional. And that means 8,756 hours are spent self-managing. So it's important because it's basically what we're doing most of the time. And by supporting people to self-manage and feel in control of their health and well-being and know where to access support and services that help them, by doing this, you are giving them the best chance to live a full life. We also know that it works. As I say, it puts individuals in the driving seat of their health and well-being, and it supports the delivery of person-centred care. We've heard many benefits of self-management come through the various funded projects of the Self-Management Fund, and for all those great projects that are nominated for the Self-Management Awards, nominated and awarded. And we want to increase understanding of self-management through our work and the real value it has as an essential component of health and social care. And as you can see, there are also huge benefits for practitioners. Self-management can help practitioners as it enables the individuals that we are supporting to be better informed about their conditions, better prepared for everyday challenges, and better supported when they need it. And this in turn leads to a more constructive use of consultation time, which can look like fewer appointments or more effective appointments, and the right people giving the right support at the right time, all of which leads to improved health outcomes for individuals. So it's that kind of what matters to you. If some of you have come across that, it's a big kind of movement that's happening. It's been happening for a number of years now. And our colleague Tommy does a lot of work around what matters to you, Tommy Whitelaw. So it's really about finding out what matters to that individual you're working with and having that meaningful conversation with them. So now to tell you a bit about self-management reflective practice, or SMRP for short. This is an accredited training for practitioners that we deliver on request, and which was designed with the voice of lived experience at heart. So back in 2017, the self-management team brought together a mix of individuals living with a long-term condition and unpaid carers to gather their views on what they would like to see from professionals to support their self-management. From these insights and learning, a training module was created, which is now an in-depth half-day training session. But it can also be tailored. It can be condensed. We've done it in less than half a day. But it's a reflective and interactive session that's tailored to the needs of the group and provides a chance to reflect on what you're already doing to support self-management and how this can be strengthened. And we look at the different ways individuals and practitioners can access relevant support. It also looks at the challenges and solutions around supporting people to self-manage and provides a space to think about what action can be taken to support self-management approaches. So during an SMRP session, as we explore the various challenges that practitioners can encounter when supporting people to self-manage, we invite the group to consider possible solutions and work through them together. There are many different challenges that come up in these discussions, and they vary depending on who we're delivering the session to. But it can include things like organisational challenges and challenges specific to roles, and often themes can centre around expectations, time constraints, lack of appropriate knowledge, service changes. However, one thing that we always make a point of doing in a session is to introduce participants to ALISS, or remind them of it if it's something that they've previously used, maybe gotten out of the way of using, because we know it's really just such a simple resource that can help practitioners to support individuals to better self-manage their health and well-being. So I'll hand you back over to Amber now, who's going to tell you a bit more about ALISS and why this self-management resource is invaluable for community well-being. And please do keep in touch with us if you'd like to become involved in the Self-Management Network Scotland, or if you'd like to find out more about SMRP. Thank you.